With the coronavirus test kits now in Hawaii, residents and visitors are able to be tested with quick results. So how is it being determined who will get tested and how does it work? Edward Desmond from the Department of Health joins us now with answers to those questions and more. Good morning and welcome.
Good morning.
So first of all, what are the steps for the testings? We've seen it and the lab as well, but what are the proper steps? What's the protocol?
Well, the protocol is that swab specimens are collected from the patient, a nasopharyngeal swab. So this is a swab inserted through the nose to the back of the throat. And then also an oropharyngeal swab. So that's inserted through the mouth to the back of the throat, 2 specimens.
So 2 quick swabs?
Yes.
And then how is it determined who will be tested? Because now the CDC is saying doctors who think that a person might have it can get them tested.
Currently, here in Hawaii, we're testing specimens from persons under investigation, and those are defined according to national criteria by our state epidemiology group. So it's Dr. Sarah Park's Division of Outbreak Control.
And how quickly can you receive the results?
When we receive a specimen in the morning, we try to get the specimen out the result out the same day. The
same day. So once what exactly is that process? Once you swab it, how many hours do you wait? How many, what exactly happens?
Okay, so the swabs are placed in a viral transport medium, and those are sent to the laboratory. And first we extract the genetic material from the specimen. And if the virus is present, then of course the genetic material from the virus will be there. So then we do an amplification step. We want to have a very sensitive test that can detect a very small amount of the virus. So there's something called the polymerase chain reaction that amplifies the amount of the viral nucleic acid. And then we have a very sensitive detection method, which is fluorescent probes. And this all takes place in a sophisticated instrument, a real-time PCR machine is what we call it.
And again, you could get those results the same day, you just said, right?
Right. The actual assay procedure takes about 3 hours.
Wow. And how many tests have actually been done in Hawaii so far?
6.
6 tests.
Right.
And what can you say about in terms of supply and demand? Do we have enough tests on island right now, and for how long?
Well, we have 3 kits. Each kit is capable of doing 1,000 reactions. But we have to run what we call controls, positive and negative controls, to make sure the test is working properly. And then sometimes we have to repeat testing. So we think for a 1,000 test kit, we're going to get 600 or so patient results from one kit. So with 3 kits on hand, that's about 1,800. And we can order more kits if we need to.
There were delays before. If you had to reorder, how quickly could they be here?
We can get them. I think the turnaround time would be about a week.
About a week?
Yeah.
Okay. You had just mentioned about retesting. What would prompt you to retest?
If the result was borderline, not quite strongly positive, not really negative, then we might retest it.
Okay, so is there a chance of getting a false positive?
Very little chance of that. The test seems to be very robust.
Very robust, okay. And what's your message out there to people watching? Everyone is concerned about the coronavirus.
Well, the message is that we're hoping for the best and preparing for the worst, of course. I think that people should not panic. That the health department is prepared for all the eventualities, and we have plans for the next steps if they should happen. We should get community spread.
Okay, thank you so much, Edward Desmond from the State Health Department, for stopping by and for answering these questions.
Okay, thank you.
We'll break down the stories you need to know about today. That's next on Take 2. Plus, Dallas joins us live from Kaka'ako to show us what's new.